Please subscribe, share and like. Today in this video class we will learn about the retrograde pylourethropy. Retrograde pylourethropy. What is retrograde pylourethropy? Why we should do this? Okay. Whenever after study of the IVP, if it doesn't give any proper information, then the radiologist will go to the retrograde pylourethropy. Okay. Preparation of the patient. How to prepare the patient for the retrograde pylourethropy. So a patient will be taken to the operation theatre under general anesthesia. Ureteral catheters are introduced. The patient who undergoes the retrograde pylourethropy, that patient will be taken to the operation theatre. There under general anesthesia, ureteral catheters are introduced via cystoscopy. Okay. Patient is brought to radiology after insertion of ureteral catheters. Then the patient under the general anesthesia, patient is brought to the radiology department. Then on the patient is brought to the radiology department and on stretcher trolley. After recovers fully from the anesthesia, and he should not be in anesthesia. After recovering the anesthesia, he will be brought to the radiology department. Care to be taken not to allow him to pull catheters, ureteral catheters. So, the radiographers, the staff should take care that already catheters are introduced into the ureters in the theatre. So, sometimes patients after completion of or after recovery of anesthesia, he may pull out the catheters. So, we should take care about it. So, contrast media, which contrast media is injected, how much contrast media is injected in the catheters. Let us see further. Conductivity or its equivalent 8 to 10 ml per each kidney. 8 to 10 ml is injected. Third, in case of hydronephrosis, we may require more according to the gravity of the hydronephrosis. Okay. So, the retrograde pylourethropy is the study of the kidneys and ureters, and bladder, urethra. So, most of the interest is shown on the pelvic calyces of the kidneys. Okay. So, after this is the contrast which is used for that. Next, before injecting the contrast, the radiographer must take a scout film, or it is called guide film. Patient is so what is the position of the patient also we should understand. The patient is from the stretcher, he is shifted to on the X-ray coach in supine position, and midline of the patient or medial septal plane of the patient and midline of the X-ray table must be coincide each other. Okay, and then a 15-12 size cassette is placed under the bucky and the bucky tray with its lower end, and the 15-12 cassette lower end should be at the level of the symphysis fibus. Okay, then it It includes the automatically kidney, ureters and bladder region also. Exposure is made when arrested respiration to avoid blurring. Then whenever you take the X-ray, the scope film, the radiographer must ask the patient to hold the breath to avoid the blurriness on the X-ray film. Catheter images due to movement. Centering is to be midpoint of the catheter. So to avoid the blurriness, we should ask the patient to stop the breath. So next we will go. Your right or left another anterior oblique may be required if any opacity is shown in the line of catheters. Even if any opacity is seen in the film, then only the oblique view of the patient is required. That is 30 degrees. Okay, a right or left anterior oblique may be required. When it is required, any opacity is shown in the line of the catheter. On the line of the catheter, if any opacity is shown, then only right or left 30 degrees oblique is left anterior oblique is required. Otherwise, not necessary. So, the centering is on the midline of raised side, midline of the raised side to midpoint of the cassette. Okay. Lower part of the cassette is at the level of the symphysis pubis. Lower level of the cassette should be at the level of the symphysis pubis. Technical factors for average patient, AP view, anterior posterior view, KVP is 85, MAS is 120 MAS. But 85 kVp and 140 MAS for oblique view we should consider. Radiographer, you must remember this one. Technique. What is the technique? Syringes are connected to the right and left catheter and about 8 cc contrast medium injected. So already in the operation theatre, the catheters are under the general anesthesia. Catheters are introduced into the ureters by the help of the cystoscopy. Okay, into that contrast is 80 cc contrast medium is injected. These radiographs are processed. Okay, you should take the radiograph. After that, these radiographs are processed. Processing means developing, fixing. Developing, washing, and after fixing. Then they are satisfactory. Catheters are withdrawn to level of lower one-third. Suppose after seeing those films, if it is satisfactory, then catheters are pulled down up to the one-third of the ureters. Okay. Overcourse examination is done in AP view. Patient is in supine position on X-ray coach. Midline for scout film. Filling phase film for kidney region. Filling phase film for kidney region 1 you have to take. Catheter withdrawal film of entire KUV region should be taken. Oblique view films may be done whenever indicated using same technical exposure factors as for the scout film. Wet films are viewed after every radiograph is taken. After taking the radiographs, every wet film is viewed. So modifications in case where catheter was introduced to relieve acute renal obstruction, it shall be left behind even after the R.G.P study. Okay, do you understand? In case when catheter was introduced to relieve acute renal obstruction, it shall be left behind even after R.G.P study. Okay. Second one, if retrograde catheterization is found to be impossible to fullest extent, then reflex ureterograms are done. Reflex ureterograms are done by using a brass bulb catheter, which is placed. Where it is placed? Which is placed impacted in the lower ureter and cystoscopy. Okay. The contrast medium is injected and overcoach films are done for KUB region with catheter inside. Okay. This is the retrograde pyelography, retrograde pyloureterography. So radiographers should know, not only radiographers, even nurses also must know the retrograde pyelography. This is the study of the kidneys and pelvicals of the kidneys and ureters. Okay, if information is not given properly in the IVU or IVP, the retrograde pyloureterography is done. Okay, thank you very much for watching this video. Please subscribe, share and like. If you share and like, we can produce many more videos for your knowledge. Okay, thank you very much.